My name is Ava Henness, and I will be presenting my academic research project about posttraumatic growth in pediatric cancer patients. Before we begin, I would like to express my deep gratitude to Dr. Larson and Ms. Dan for their professional advice, valuable guidance, and useful suggestions throughout the development of this research project. I would also like to extend my thanks to Dr. Andresma for helping me gather ideas and proposing the various directions I could follow for my final product. In addition, I would like to thank Renee Dwayhe-Logan and her daughter Allison for allowing me to interview them about their perspective of Allison's cancer process. Finally, I would like to thank the Puma family and Addison Puma for inspiring me to pursue the topic of childhood cancer. According to the Childhood Cancer Association, approximately 15,780 children are diagnosed with cancer each year in the United States. The process that pediatric cancer patients endure is extremely difficult and may cause them severe emotional distress, including depression, anxiety, and stress. Children with brain tumors are especially prone to neurological damage due to their developing brains and bodies. Not only does the cancer process mentally have an impact on children, but it also affects them physically. Physical symptoms such as pain, lack of energy, drowsiness, nausea, and vomiting are extremely prevalent in pediatric cancer patients undergoing different treatments such as radiotherapy and chemotherapy. However, the severity and type of these symptoms differ depending on type of cancer and type of procedure or treatment. Thus, the quality of life of pediatric cancer patients is a crucial issue to examine in order to determine the best practice for addressing both emotional and physical symptoms. Whereas some children experience psychological trauma as a result of cancer, many children actually experience a phenomenon known as posttraumatic growth. According to an investigation conducted by Andrea M. Turner-Sack, a graduate student at the University of Windsor, and Roseanne Mena, a clinical child psychologist and associate professor at the Department of Psychology at the University of Windsor, post-traumatic growth is the dramatic, positive psychological changes in a person's perspectives, life priorities, and interpersonal relationships, commonly caused by traumatic experiences. This incredible effect can be achieved through various applications and methods known as active coping. Active coping is a coping style in which an issue is directly addressed and examined as opposed to using distraction to avoid the real root in the matter. Methods such as cognitive reconstructing, relaxation, practical strategies, seeking social support, and expressing feelings are all distinct types of active coping and can be executed in a vicinity of different approaches. In this examination, it was considered how post-traumatic growth could be best achieved in pediatric cancer patients. In order to address this question, exploratory research was conducted regarding the amount of children impacted by cancer, their quality of lives under the circumstances, the rigorous treatments they must undergo, and the severe side effects they endure as a result. In addition, an interview was conducted with the family of a child cancer survivor in order to more thoroughly understand the distressing process a pediatric cancer patient must experience, as well as gain a first-hand perspective of different types of cancer stressors. After comparing the preliminary research in accordance with the interview, it was found that implementing a variety of active coping strategies into the routine of these children as early as the initial cancer diagnosis would result in the greatest amount of post-traumatic growth. However, due to the fact that post-traumatic growth and active coping are generally unfamiliar concepts to families of child cancer patients and not a widespread concern among them, a children's book promoting post-traumatic growth to pediatric cancer patients was created to serve as an approach to inform, educate, and encourage children and families about different methods of active coping, as well as its benefits. The book explores the story of a boy named Oliver who's in the process of undergoing chemotherapy for his brain tumor. He is experiencing many side effects, including pain, fatigue, and nausea. Because of this, he becomes very discouraged and tired of putting up with all of it. His mother encourages him to make an effort to try different types of active coping methods in an attempt to promote post-traumatic growth. He tries various methods of active coping, and after some obstacles, he finds the method he likes the best. Now, I will read aloud my children's book, Oliver's Journey. Hi, I'm Oliver. I'm just a typical 8-year-old boy. I love music, spending time with my friends and family, and my pet dog named Henry. But there's something about myself that makes me pretty different than most kids. I have a brain tumor, which is a clump of irregular cells in your brain. I'm also undergoing chemotherapy, and because of it, I'm not as strong as other kids. Since chemotherapy causes many side effects like pain, fatigue, and nausea, sometimes I become discouraged because I get tired of putting up with it all. However, there are lots of ways to manage these symptoms. So, Here's the story of my experience with finding a solution that works for me. One day, Oliver's mother instructed him that he should try some different methods of active coping to benefit his mental health in the future and hopefully achieve post-traumatic growth. Active coping is a specific type of coping style involving using specific strategies to work directly toward the difficulty, as opposed to distraction. And post-traumatic growth is a positive psychological shift in a person's life perspective after overcoming a traumatic event such as cancer. Active coping is a great way for you to feel happier both now and in the long run. It can help you maintain a healthy mind in the future. There are lots of different methods of active coping, such as eating healthier, seeing a specialist, or even relaxation. Would you like to give it a try? Oliver's mother asked. No thanks, Oliver responded. That sounds silly. How would eating healthy help me feel better? When you intake healthy foods, your body will have more energy and you won't feel as tired or drowsy anymore, Oliver's mother explained. So, why don't we start straying away from pop and junk food and start eating fresh vegetables, lean protein, and fruit smoothies? We could even begin taking accessible exercise classes to improve your muscle strength, decrease fatigue levels, and build your stamina. Fine, I'll try it out, but please don't make me eat food that I dislike, Oliver pleaded. Of course not, Oliver's mother assured. I'll find some yummy recipes to make and also sign us up for some fun but manageable aerobic classes recommended by your doctor. Okay, thanks Mom, Oliver expressed. After several weeks of experimenting with different recipes and testing out different exercise classes, Oliver decided he wanted to try something else. His fatigue levels did improve, but he still felt very discouraged. Oliver's mother next suggested trying reaching out to a specialist to encourage him to share his feelings about himself and receive professional counseling. Oliver, we can continue to eat healthy and exercise, but how about we try an additional method of coping? We could go to a specialist and you'd be able to discuss the feelings you've been experiencing lately. It could be a great way for you to express how you feel when you get tired of handling your symptoms. Also, you would be in a safe environment because you'd be working with a professional therapist, Oliver's mother mentioned. I guess I could try it out. All I want is to feel happier, Oliver indicated. But how would a therapist help me feel better if they just talk to me? They can't get rid of my side effects. Oliver, a therapist may not be able to clear you of your side effects, because that's what your exercise classes and healthy eating helps to accomplish. However, a therapist can listen to you talk about your feelings, analyze your issues, provide you with comfort, and offer you professional advice. Therapists primarily benefit you emotionally as opposed to physically, Oliver's mother advised. Oh, okay, that makes sense. I'll give it a chance, Oliver replied. After many sessions with a psychotherapist, Oliver began noticing some slight improvements in terms of his mood. However, he didn't necessarily think that this was enough to significantly improve his disposition. As another method of active coping, Oliver's mother suggested he tried relaxation as a way to inhibit his feelings of sadness and chemotherapy-induced side effects. I know that eating healthy, exercising, and therapy did somewhat help you, but what if we tried another method of active coping? We could try some different types of relaxation. What about art therapy? You love musical theater, and you're an artistic kid. I think you would find it very beneficial to your mental health, Oliver's mother suggested. That actually sounds kind of cool. What would I be doing? Oliver asked. There are many different types of art therapy. One of the most common approaches is painting with a trained art therapist. It allows you to express your feelings creatively because you'll be able to paint how you feel with the help of a trained professional, Oliver's mother explained. Would the therapist be teaching me to paint, or would I get to paint whenever I wanted? Oliver inquired. They wouldn't be instructing you how to paint a certain drawing or picture, but rather teaching you how you can communicate your emotions through colors, shapes, and textures, Oliver's mother described. That actually sounds super calm and relaxing. I'd love to give it a try. After many sessions working with an art therapist, Oliver had begun showing many signs of an improved mental state. He was happier, more confident, and had a more positive mindset overall. Although he continued to eat healthy, exercise, and meet with a psychotherapist, Oliver loved going to art therapy the most. Every week, he would become extremely excited to attend an art therapy session, and it eventually became a part of his permanent routine. Hey everyone, Oliver here again. I hope you enjoyed learning about how I found the method for active coping that works best for me. Although I eventually realized art therapy made me feel the best, another person might prefer a different method. If you are in the same situation as me, I would suggest trying as many different strategies as possible until you find the one that works best for you. Even if you think trying something won't make a difference, it never hurts to try. You might even surprise yourself. Again, thank you to friends, family, and teachers for allowing me to pursue this topic for my academic research project. Thank you for watching.